Most people rarely think about their kidneys until something begins to feel wrong, until the body quietly starts sending signals that something deeper is happening beneath the surface. Imagine waking up one day feeling heavier, your legs slightly swollen, your breathing not quite as easy as it once was, and yet you cannot explain why. The truth is that the kidneys, two small organs hidden deep within the body, are responsible for one of the most delicate balances in human life, the balance of fluid. Every single day, your kidneys work silently, filtering waste, adjusting minerals, and carefully controlling how much water your body should hold and how much it should release. It is a quiet process, invisible to most people, yet absolutely essential for survival. When that balance begins to fail, the body enters a silent struggle that many individuals with chronic kidney disease face without even realizing it at first. Chronic kidney disease, often called CKD, is not simply a condition of weakened kidneys. It is a gradual shift in how the entire body manages its internal harmony. One of the most serious challenges within this condition is fluid overload, a situation where the body begins to hold more fluid than it can safely manage. This excess fluid does not simply stay in one place. It spreads through tissues, gathers in the legs, strains the heart, and can even fill the lungs, turning something as natural as breathing into a difficult task. In many educational discussions, Dr. Matthew R. Weir has emphasized that understanding the body's fluid balance is one of the most important lessons a patient with kidney disease can learn. The idea may sound simple at first, but the deeper truth is far more powerful. The human body is a system of balance, and when the kidneys weaken, that balance must be protected through knowledge, discipline, and awareness. Many people underestimate how strongly small daily choices influence the body's fluid stability. A pinch of salt, an extra glass of water, or a missed medication may appear harmless in the moment, yet these decisions slowly shape how the body manages fluid throughout the day. Over time, what seems small becomes significant. Fluid begins to gather quietly in tissues. Swelling may appear around the ankles, and fatigue begins to replace the energy that once felt normal. The body is speaking, but it speaks in subtle ways. This is why education becomes one of the strongest tools a patient can possess. When people begin to understand how the kidneys control fluid, they start to recognize the signals the body sends. They learn that managing sodium intake is not simply a dietary rule, but a way of protecting the heart and lungs from unnecessary stress. They realize that fluid management is not about restriction alone. It is about awareness, timing, and balance. The wisdom shared through medical education, including the teachings associated with Dr. Matthew R. Weir, reminds patients that knowledge transforms fear into control. Instead of feeling powerless against a diagnosis, individuals begin to see the path forward with clarity. They understand that every healthy decision becomes part of a larger system of protection for the body. The journey of chronic kidney disease may seem overwhelming at first, but understanding fluid balance changes the perspective completely. It reveals that the body is not simply failing. It is asking for guidance, patience, and care. Within that realization lies a powerful truth. Even when kidney function declines, the ability to influence health through awareness still remains. Every day offers a new opportunity to protect the body's balance, to respect the signals it provides, and to move forward with the knowledge that understanding the smallest details of health can lead to the greatest changes in life. But what many people do not realize is that fluid overload rarely announces itself loudly at the beginning. It moves quietly, almost invisibly, building its presence within the body, while daily life continues as usual. A person may notice that their shoes feel tighter in the evening, or that climbing a short flight of stairs suddenly feels more exhausting than it used to. These small changes are easy to ignore. Life is busy, responsibilities continue, and the body often adapts for a while before the warning signs become impossible to overlook. Yet inside, something important is happening. The kidneys, once efficient guardians of balance, are gradually losing the ability to remove extra fluid and sodium from the bloodstream. As this process continues, the body begins to hold on to water in places where it was never meant to stay. Fluid gathers slowly in tissues, the ankles swell, the face may appear slightly puffier in the morning, and breathing can become heavier during simple movements. The most concerning part of this process is that it can progress quietly until one day the body suddenly demands attention. That is where the real suspense of chronic kidney disease appears, because the struggle is not always visible on the outside until the internal balance has already shifted significantly. In many medical discussions about kidney health, Dr. Matthew R. Weir has highlighted that fluid management is not just a technical medical concept. It is a daily practice that requires awareness and discipline. Understanding the science behind fluid overload can empower patients to take control of their health before complications become severe. The heart and lungs, two organs that work tirelessly every moment of life, are deeply affected by excess fluid in the body. When fluid begins to accumulate, the heart must work harder to pump blood effectively, and the lungs may struggle to provide enough oxygen because fluid pressure interferes with normal breathing. This is why learning about fluid balance becomes such a powerful protective tool. Every choice related to diet, hydration, medication, and lifestyle slowly influences how the body handles this delicate balance. Sodium, for example, plays a major role in fluid retention. Even small increases in salt intake can cause the body to hold more water than it should, placing additional strain on the kidneys that are already struggling. The challenge is not simply avoiding certain foods, but understanding how the body responds to them. Knowledge creates awareness, and awareness changes behavior. When individuals begin to recognize how their daily habits affect fluid levels, they gain a sense of control that can transform their entire health journey. There is also a deeper psychological dimension to this experience. A diagnosis like chronic kidney disease can initially feel like a loss of certainty, as if the body can no longer be trusted the way it once was. Yet education and understanding gradually replace fear with clarity. Instead of viewing the condition as an unstoppable decline, patients start to see a pathway of management and resilience. This perspective is often reflected in the educational philosophy associated with Dr. Matthew R. Weir, where knowledge is treated as one of the most powerful forms of medicine. When people learn how their bodies function, they are no longer passive observers of their health. They become active participants in protecting it. The suspense in this journey lies in a simple question that every patient eventually faces. Will they listen to the signals of their body before the imbalance grows too strong? The answer to that question can shape the entire course of the disease. Some individuals begin to recognize the warning signs early, adjusting their habits, monitoring their fluid intake, and working closely with medical guidance to maintain stability. Others may delay these changes until symptoms become more difficult to manage. But the truth remains the same for everyone living with kidney disease. The body constantly communicates what it needs. Swelling, fatigue, breathlessness, and weight changes are not random events. They are messages. Learning to interpret those messages is one of the most valuable skills a patient can develop. When awareness grows, fear begins to fade, and in its place emerges a powerful sense of responsibility toward one's own health and well-being. There comes a moment in every health journey when knowledge transforms into responsibility, and that moment can redefine the way a person views their own body. Chronic kidney disease may begin as a medical diagnosis, but over time it becomes a lesson about awareness, discipline, and the incredible resilience of the human body. Fluid balance, something most people never think about during their healthy years, suddenly becomes one of the most important elements of daily life. Every morning begins with a quiet question. How is the body feeling today? Is breathing comfortable? Are the legs light and steady? Does energy flow naturally through the day? These simple reflections become powerful tools for people learning to manage kidney disease. The truth is that the body is constantly communicating, offering signals that reveal whether balance is being protected or slowly slipping away. What makes this journey remarkable is that even when kidney function declines, the ability to influence health does not disappear. Through awareness, education, and consistent care, individuals can still protect their heart, lungs, and overall well-being. In many educational discussions, Dr. Matthew R. Weir has emphasized that understanding fluid management is one of the most practical ways for patients to regain a sense of control over their condition. This idea carries a deeper philosophical meaning as well. It reminds us that health is rarely determined by one single decision. It is shaped by hundreds of small choices made every day. The amount of salt in a meal, the timing of medication, the awareness of how much fluid the body truly needs, and the willingness to listen when the body sends a warning sign, all become part of a larger pattern of self-care. Many people initially feel overwhelmed by these adjustments, but with time they begin to realize something powerful. Discipline creates freedom. When patients understand how to manage fluid intake, reduce sodium, and maintain communication with their healthcare providers, they often experience fewer complications and greater stability in their daily lives. The swelling that once appeared frequently may begin to decrease. Breathing becomes easier, and the body regains a sense of calm balance. This transformation does not happen overnight, but it grows gradually as knowledge turns into habit. The teachings associated with Dr. Matthew R. Weir often remind patients that managing chronic kidney disease is not about perfection. It is about consistent awareness and commitment. Even small improvements in daily habits can create meaningful protection for the body over time. The journey also carries a powerful message about patience. The body does not always recover instantly, and progress can feel slow at times. Yet every step toward better fluid management strengthens the body's ability to maintain balance. What once felt like a frightening diagnosis slowly becomes a pathway toward deeper understanding of health. Patients begin to realize that their role in this process matters greatly. Doctors provide guidance, science offers knowledge, but the daily decisions made at home are what truly shape long-term outcomes. When people accept this responsibility with confidence rather than fear, they unlock a new level of personal strength. The story of chronic kidney disease then changes from one of helplessness to one of determination and resilience. It becomes a reminder that even in the face of physical challenges, the human spirit remains capable of learning, adapting, and moving forward with purpose. Every day offers another opportunity to protect the body's delicate balance, to respect the signals it provides, and to apply the knowledge that medical experts continue to share with the world. Awareness becomes the bridge between illness and stability, guiding patients toward wiser choices and a more hopeful future. If you're benefiting from our topics, please subscribe, like, and turn on the bell notification so you can see our new videos early.